When a patient presents to their general practitioner or GP with Raynaud's phenomenon, it's very important to determine whether it is primary Raynaud's phenomenon or whether it is secondary to another disease, such as scleroderma. This can be determined by a series of investigations, and the most important of these are simple blood tests that could look for the presence of specific proteins called anti-nuclear antibodies. These proteins are present in almost all cases of scleroderma and help to make the diagnosis. When a patient with suspected scleroderma is referred to a specialist centre, they will undergo further investigations. Some of these will be a repeat of the blood tests that they've undertaken with their GP, but they'll also go on and have more specialised tests. The first tests that are performed are often those that look for evidence of blood vessel damage, and these include a test called capillaroscopy, where the small blood vessels are examined in detail under a microscope at the fingertip, and thermography, which measures temperature responses and confirms the presence of Raynaud's phenomenon and assesses its severity. Later, patients go on to have screening tests to look at the other organs that might be affected by scleroderma, including X-rays of the hands and feet and of the chest, and also pulmonary function tests to determine whether there is any respiratory involvement. They will later go on often to have other more sophisticated tests, which are determined really by the organs that are involved with scleroderma.